Good afternoon, everyone. We're so glad you could join us. This is the final webinar in the 6-part Child Care Emergency Preparedness and Response Plan series. My name is Gail Kelso. I'm the Region 6 State Systems Specialist of the Child Care State Systems Specialist Network, a service of the Office of Child Care. I'm going to turn it over now to our colleague Adam Ash, who will walk you through a few technology logistics.
Sure, thank you for that, Gail. Hi, everyone. We're excited that you could join us again for our 6th and final webinar. Just a couple of quick notes. This meeting is being recorded, and the webinar is being broadcast through your computer speakers, so hopefully everyone can hear me now. There is no call-in option for this webinar. Despite the fact that there isn't a way for you to join in the discussion verbally, we still encourage you to participate using our Adobe Connect technology. If you have questions for the presenters about the topics discussed, please write a question in the Q&A pod in the top center of your screen. These questions will either be addressed in the Q&A portion of today's webinar, or we will follow up with you afterwards. If you have general comments or an immediate need, they can be entered in the chat pod at the bottom of the middle of the screen. We'd also like to let you know that unfortunately on a webinar with this many participants, we're not able to do much about troubleshooting for individual participants. However, keep in mind that we are recording the webinar should you encounter any technological difficulties. Also, note that many issues can be resolved by leaving the webinar and joining the meeting room again. Now with that, I pass it back over to Gail so we can get started.
Thank you, Adam. We have had great success with our technology on these webinars, so we hope that we can continue that today. Welcome again. This is the final session in the Child Care Emergency Preparedness and Response Plan series, but it is not the end of our interest or willingness to help states think about, collaborate to develop, implement, and revise plans for supporting the CCDF program. You're going to also be planning for providers, children, and families in your state as well. At the end of the webinar, we'll talk about next steps in these continuing efforts. It's my pleasure to introduce the other EPR team members. Abby Cohen, Region 9, is the project lead. Susan Rohrberg, Region 5. Lori Sommerfeld, actually on vacation today, and today Adam is helping us with our technology assistance. The series represents the work across many states as they have responded to state and local emergencies and the impact of those emergencies on their child care system. These 6 webinars support states and territories' development of collaborative EPR plans as framed by OCC. The series was developed in recognition of and with sensitivity to the complexity of the topic, acknowledging not only the multiple systems and stakeholders that must be considered, but also the emotional response that the topic triggers, and with awareness of individual states and territories' progress in creating a plan. Some are beginning, while others are revising and expanding their plans. While our focus on today is on recovering and responding to trauma, planning and preparation can prevent or mitigate the impact of traumatic events for children and adults. So it should be considered in the development of a comprehensive state child care EPR plan. The series has included speakers from federal and state government as well as national experts, and we hope your input and questions will also add to this discussion. The webinar was designed so that participants could choose sessions of interest or need. States which do have emergency preparedness as a technical assistance goal have been strongly encouraged to participate in all sessions. Participants are asked to interact via chat, word cloud, polling, and question and answer pods. All webinars have been recorded, as is this one. We're working on transcription and archival, and technical assistance may be available to CCDF lead agencies and their partners through the State Systems Specialist Network in collaboration with the CCTAN partners and regional offices. Another reminder that all lines are muted in order to provide the best audio experience for participants. Questions will be compiled and answered following each session and provided as an FAQ resource. Susan Rohrbach has agreed to share the webinar facilitation duties today, and we're also going to hear from Abby Cohen as well. Susan?
Thank you, Gail. And it is really great to be part of this final webinar. I've had the opportunity, as Gail said, part of the Emergency Preparedness and Response team since its inception in this webinar series, and I know I personally have learned as much as I hope many of you who have participated or have heard the webinar series via our recordings. The Region 5 states with whom I work have actively been engaged in this work, so it's really given me an opportunity to be able to learn more and hopefully be able to share more with them and with other states and my partners that I work with throughout the country. The series has been an excellent starting place for engaging and informing all of us, as well as providing specific information and state and territory examples. So what we'd like to do now is, we know from the registration process that we have representation across all of the Administration for Children and Family regions for the Office of Child Care and other partners, with approximately 95 participants registered for today's call. We are now going to conduct a poll, poll 1. Adam, if you could change that slide for us, please. Please respond using the polling function by clicking on the answer that best describes you. This helps us to know more about those of you participating today, so we really appreciate your providing us with additional insights and information. We can see already that we have representation from a number of places, from state and territory CCDF administrators or staff who they work with, as well as child care resource and referral agencies, ACF regional offices, and other, which I know that we have some different folks joining us. I thank you, Alicia. Child Care Licensing is here with us. Child Care Health Consultant for the state, and I know that's Indiana. Thank you, Nancy. The Head Start State Collaboration Office. Thank you, Lily. Nice to know what partners are here also with us as we think about the multiple stakeholders that it takes to work on this type of work in a state or territory. So our results today show we have a number of different groups. Oh, great. Thank you, Sonia. Child Care and Parent Services Business Operations. So a really diverse group of different stakeholders that we can draw upon and are good examples for us to think about if we have it in the respective states and territories we work in. As mentioned, the webinar series is designed to support states and territories as you continue in your emergency history to be prepared and how you use your emergency history. And here on this particular PowerPoint slide are 4 specific reasons why child care and planning for emergency and response is important. As you can see, planning minimizes likelihood of injuries and deaths who are particularly vulnerable in disasters for children. Preparation minimizes the psychological impact or trauma and can promote resilience in children and adults. Planning and preparation may reduce revenue loss and provider liability and promote continuity of care, which I know many of us and all of us are always concerned about. And child care definitely is a vital source to the community. So the speed at which child care is able to recover is definitely a need that communities can feel and can help speed up that process with time. Remember, if you have questions, please enter them into the Q&A pod at the top of our screen in the middle. And we'll be watching for questions, and be sure to ask them at the end of the webinar. So if things may be generated as you listen today, please know we are looking forward to hearing from you, and we'll be using your questions with our presenters. with whom we are very fortunate today for our agenda to have Margaret Nichols from the Erickson Institute, who will be providing us with information about understanding real impact of trauma, experiencing disaster, the Joplin's 2011 experience from Betty and Nicole, and then about resiliency from Jessica Burton from Save the Children. Throughout the webinar, we've allotted time for you to ask questions. So again, remember the questions to ask, put them into the Q&A pod. We'll be using those. And information about our presenters today, as through the whole webinar series, will be available, including their contact information that will be posted and sent to you following today's webinar. If you attended our first webinar in July, Amy Spates of the Office of Child Care described the Office of Child Care's rationale for requiring child care emergency preparedness and response plans. Amy stated that this IM 2011 was written with the goal for each lead state agency administering CCDF that they will develop and maintain a written, comprehensive, multi-hazard plan to address emergency preparedness, response and recovery efforts specific to child care services and programs. While it was not necessary to view all the webinars, when viewed together, they do represent the comprehensive information memorandum described by the Office of Child Care. Information will be sent to you following today's webinar, as I've noted, about where to find the webinar series and the resources that have been developed or updated as part of this series. You may notice that responding to trauma, which is our topic today, is not included in the Office of Child Care's information memorandum. However, Abby Cohen, who has been leading and working on this topic, emergency preparedness and response issues, and specifically planning this series for us all, has really focused on this over the last 3.5 years. So I have the great privilege and honor to introduce Abby Cohen, my colleague and friend, and our lead on this important webinar series. So Abby, I turn to you.
Thanks, Susan. And I wanted to say why it is that we decided that we should, in fact, incorporate these topics in this webinar series. And as Susan noted, our first webinar was about how we would bring all the stakeholders together. Our second webinar was about how we would continue to plan for subsidy services. The third was about regulatory requirements. The fourth was about technical assistance and support to child care providers. Then we had one on both number 4 and 5 as listed on that IM about temporary child care services after a disaster, and also rebuilding. But as I worked on pulling together some of the material around this and talked to people around the country, it became really apparent that one of the most significant issues that child care providers and the states that support them face after a disaster are the mental health consequences of those disasters, both for the children, the families of those children, as well as the providers. And one of the responses to that recognition of the mental health issues was the development in many of the locales after the disasters of children and youth task forces. So we determined that it really would be quite helpful to incorporate both a focus on the trauma and resilience issues as they impact children and families and providers, and also to focus some of our attention on the development of children and youth task forces, and to think about all of these issues in the context of larger comprehensive emergency plans at the state level. We need to have both of these things operative so that we can have the best protection for children, families, and the providers that are involved. So I'll turn it back over to Margaret.
Hello, everybody. This is Margaret Nichols. I'm from the Erickson Institute in Chicago. And I will be talking to you about the impact of natural disasters and other traumatic experiences on children as a way to give you a context of why you are putting all of these wonderful plans and strategies into place, and really the importance of all that. So let us jump right in. So the mental health perspective about the importance of responding to trauma is what I will talk to you about. And here are the 5 topics that we will cover together really quick. One is, I thought it would be helpful for all of you to get a very, very brief thumbnail summary of the Foundations for Children's Physical and Psychological Well-Being, because by definition, what we're concerned about is when that becomes endangered. And so if we understand what children need, we will also know better as to what we can provide for them when these natural disasters and emergencies occur. I will talk to you about what it looks like in children and literally on the brain level when they are exposed to trauma. We will talk about what some of the consequences of trauma exposure might be for children. But we also know that not every child who experiences trauma, let's say car accident or the topic we're concerned with today, natural disasters, actually suffers in the long run from, let's say, traumatic stress. So what are some of the risk factors that you need to keep in mind when you try to think about supporting children through these experiences? And then I will just give you a brief thumbnail summary of some basic trauma impact prevention principles. So let's take a quick look at Foundations for Children's Physical and Psychological Well-Being. And the first and last issue are the ones we will focus on today, and that is they need a nurturing, caring, and protective adult environment for the children to feel safe. And of course, they need healthy nutrition, medical care, environmental stimulation, including education, and then they also need predictability and structure in their lives. And if you just think about on your way this morning driving to work, hopefully for all of you, things went pretty smoothly, and you thought you would get to work in a half hour, and there you were a half hour later at work. And now think about when there is a big road construction. And if you know in advance, you can plan around it. And so when you actually get stuck in traffic, your stress level, while a little elevated, is not catastrophic. But now think about going to work and there's a huge accident, and there you sit on the street, and time is ticking, and your stress level shoots through the ceiling. Why? Because something unpredictable happened, and you don't know how to deal with it. And so the operating thing to understand here is that unpredictable things, dangerous things, things that get in our way, hugely increase our stress level. So stress is what we want to keep in mind when we think about the impact of natural disasters and environmental trauma. So these factors lead to optimal child development, and I will show you a quick slide of what that looks like. And one of the things that I would like you to note about this slide is actually how very, very important strands in our child development, how early they come online. So what you see here basically is a graph of the human brain development expressed in neuronal connections that we form, or infants and children form in their brain. And neuronal connections are the building blocks for our entire brain functioning. And what you see in the pink box is the number of neuronal connections that are made in a given time, and in the pink box it's the first year. So anything from hearing and vision and language and even higher cognitive functions comes very strongly online in the first year, and then ebbs down up to like mid-teenage years, and then kind of like slowly slows down till about young adulthood, and then it basically stays constant. So our biggest kind of brain growth happens in these early years, and one of the reasons why I emphasize that is that we often overlook very young children because we feel that they might not understand what's happening, they might not remember what's happening, and that is actually not correct. The brain is in a very sensitive developmental phase, and so anything that happens to young children, including overwhelming stress, has huge long-term impacts. So let's talk about what childhood trauma is like. Basically, any trauma, including childhood trauma, occurs when we're faced with potentially life-threatening events, or particularly for children, when these life-threatening events also include a loved one or don't even threaten us directly, but threaten our caregiver, our mother, our father, our siblings, or experiences that threaten our physical or psychological integrity. So, for example, sexual abuse would be one that may not threaten us physically necessarily, but they threaten our psychological integrity. And the result of these experiences are feelings of terror, horror, and helplessness. All of those are expressions of being flooded with stress in our system. Um, and there are acute traumatic events, which you as our listener typically respond to, chronic traumatic situations such as domestic violence or chronic traumatic stress, which is just a low level of stress in the system all the time, let's say living in a high violence community. So I promised that I would share with you what this kind of trauma, this influx of stress looks like literally on our brain system. And this is material published by the Center of the Developing Child at Harvard University, and they send the very clear message: persistent stress changes brain architecture. What you see in the first black box, these colorful squiggly lines, those are our neurons, and the little arms that go out there are the connections that our brain forms between neurons, and they are basically responsible for optimal brain functioning. The slide below looks at a brain cell that it has been exposed to what we call toxic stress, which is stress that exceed our capacity or the child's capacity for coping. And you can literally see on this very microscopic brain level that chronic high exposure to stress literally reduces our brain functioning. So all of these cognitive developments that I've showed you, language, sensory, executive functioning, can actually really be impacted by either overwhelming stress that does not get properly responded to, or by ongoing chronic stress. So I'm hoping that this will kind of illustrate to you how important it is for children all ages, but especially the younger ones who don't have as many coping strategies, that all the work that you are putting into place, how important that is. So there are some long and short-term consequences of stress generated by these brain processes, basically the killing off of neuronal connections, and those are risk for academic failure, aggressive behavior, bullying, disruptive behavior, attention problems, anxiety, depression, social isolation. In very young children, we also often see sleep or eating or even bathroom issues. And then in adolescence, you can often observe risk-taking behavior such as substance abuse, school dropout, criminal activities, and gang membership. My colleague Jessica Burton will later talk a little more about these behavior consequences. What I would like to focus on at this point is as I mentioned to you earlier, not all children who experience overwhelming stress, even if it's just a one-time overwhelming or repeated stress, not all children develop long-term negative consequences. So what are the kinds of situations that you want to think about um, specifically when you look at intervention strategies? And one of them I want to share with you is children who already have other stress and risk factors in their lives are very vulnerable to stress or trauma coming from natural disasters. So there's a study called the Adverse Childhood Experiences Study, which explored 10 very important early childhood risk factors. And they were experience of emotional abuse, experience of physical abuse, sexual abuse, domestic violence, substance abuse in the family, mental illness in the family, separation, divorce, and so on. And what the study found was that in adults who had a number of these early childhood risk factors, the outcome in terms of smoking, substance abuse, promiscuity, obesity, oppression, heart disease, lung disease, including shortened lifespan, was overwhelming. So we now know that early childhood traumatic stress can have and does have, if it is accumulative, very, very, very high risk long-term outcomes, including early death. So to give you just one example, because I know I'm running out of time, children who had 4 adverse early childhood experiences had a 7-fold increase of alcoholism later in life. They also had a 2-fold risk of cancer. So if you have 4 adverse experiences in terms of traumatic stress in childhood, your risk of getting cancer as an adult is 200%. So, and having an early childhood experience score of more than 6 increases your risk of attempted suicide 30 times more. So they summarized their finding in this pyramid that shows very much that the more early adverse traumatic stress experiences someone has, the more the neurological brain development gets disrupted, the more social, emotional, and cognitive impairment occurs, the more the health behavior becomes at risk and ultimately potentially leading to early death. So what can you keep in mind as you plan your emergency strategies? First of all, I mentioned to you before, what every child needs is the comfort and safety of a secure parent or relative relationship. So reunite children with their parents as soon as possible. And then, of course, remove children from the traumatic stimulus. So if it's flooding, get them away from water. They may not want to take a shower for a long time. Get them away from noise. Create a safe, calm environment. Train your staff to be reassuring. Create familiarity, create predictability, and create normalcy, all of which are stress-reducing factors. And also allow them to express their trauma. And with that, I will pass it on to my colleague. Thank you very much for listening.
Thank you, Margaret. This is Betty Lamley, and I'm the Regional Program Manager for the Office of Child Care in Region 7. I'm going to talk to you about the task force that was formed in Joplin, Missouri in 2011. On May 22, 2011, an EF5 tornado took a path down the heart of Joplin, Missouri, tearing out a 1-mile-plus swath through much of the business district, taking nursing homes, medical facilities, homes, and schools out. Within hours, FEMA and ACF, along with other responders, were on the ground assessing the damage and the needs of the community. At first, we heard there were 3 child care providers in the destruction zone, but it soon became apparent the damage was much worse, with at least 19 child care providers, including centers and family child care homes, damaged and destroyed. Our experience in Iowa during the flooding there a few years previously had told us that child care availability was essential for recovery efforts and for healthy recovery for children. Furthermore, excuse me, although only a town of 55,000, Joplin is an economic and business center for the Four Corner area of Missouri, Kansas, Arkansas, and Oklahoma, with the workday population swelling to 250,000. For these reasons, federal, state, and local organizations felt compelled to start a focused and collaborative effort to address the recovery of the child care industry. We started small with leadership from the 2 Missouri agencies responsible for the child care subsidy program and child care licensing, with the regional ACF leads for the Office of Child Care and the Office of Head Start, our regional emergency response specialist who was on the ground in Joplin, and the local child care resource and referral agency, Child Care Aware of Missouri. And Nicole will be speaking later about some of the things that they did. We quickly realized we needed to expand our table. We grew to include the FEMA voluntary agency liaisons, the Office of Human Services Emergency Preparedness and Response representatives from our own agency, United Way, Save the Children, local providers, Missouri Department of Mental Health, the Small Business Administration, our HHS Assistant Secretary for Preparedness and Response staff, child care providers, children's crisis centers, child abuse and neglect prevention services, and members of the Long-Term Recovery Committee in Joplin. Our Child Care Aware of Missouri representatives quickly developed a geo-map of providers in the area and served as our communication link for families, providers, community leaders, and the public in the task force. Participation in the twice-weekly meetings fluctuated depending on the agenda, but all were kept informed of issues, questions, strategies, and response through detailed minutes of our work. Our first order of business was to determine where to focus our efforts to effect the quickest recovery in the community. We identified the overarching goals of the task force that were ensure early childhood care and education is available for all families, restore the infrastructure for child care, early childhood and children's services, and support the healthy recovery for children, families, and children's services providers. While the first 2 goals were essential to recovering from the tornado, I want to focus on the last goal. This goal perhaps brought us many unexpected outcomes more so than the others from the Children's Task Force, highlighted the need and strength of a coordinated effort, and brought about beneficial results to children, families, and providers. We had anecdotal information and some experience to tell us what to expect after the disaster. Everyone in Joplin was affected by the tornado's destruction. Expected child abuse, domestic violence, substance abuse, and other family stressors would increase, we felt sure. Children were going to need stable and consistent care while families in the community recovered, and the early childhood providers had both personal and business stresses to cope with. For the child care service providers and other children's service providers, we realized that they were not only affected personally by the storm, but they had businesses that were affected too. Their operations were either damaged or destroyed and closed, or they were facing increased enrollment by families displaced at other facilities. They had staff members struggling with recovery and stress in their personal lives, and they had children in care struggling to make sense of it all and recover from the trauma. We made connections and invited the experts to the table to help us. The Department of Mental Health from Missouri and the Ozark Center, the local mental health service provider, joined the group. The Ozark Center was already forming teams of mental health crisis support persons called Healing Joplin, who were tasked with visiting every household in the city of Joplin. After joining our task force, the Ozark Center dedicated 2 of these teams to visit only child care provider facilities to talk with, evaluate, and refer for further help the staff and the children in the facilities. And they did visit every child care facility in the town and offered support and tools to deal with the stress the children saw and the stress in the staff. Through the discussions around the mental health issues at our table, new collaborations and joint efforts to address the social and emotional supports for families were born. Nicole, who will speak later, will give more details of the work that was done. So we learned what we could expect. Poor coping behaviors or mental health issues might not exhibit immediately. We did see that at the beginning, immediately after the tornado, there was a let's pull together spirit that seemed to pervade in the community. But as the recovery slogged on, other behaviors would begin to exhibit and did. As the community reached milestones along the way of their recovery, such as the start of school, the holiday season, the anniversary of the tornado, or the next summer, we would no doubt see spikes or cycles of various behaviors. This would continue long after the look of the community returned to normal. So what did Joplin experience after the tornado? The Ozark Center report, Continuing Recovery Response, lists the number of issues and behaviors that they experienced in the year to 18 months after the tornado occurred. 19% increase in child abuse and sexual trauma, a 40% increase in domestic violence, a 40% increase in gambling, an 80% increase in substance abuse, a 30% increase in suicides, with 5 more suicides related to the storm occurring outside the state. 29% suicidal subjects increase, decreased scores in 11 areas tested in the state MAP test for grades 3 through 12, 52% increase in crisis calls over the previous years. This demonstrates the need for a continued community effort to provide emotional support through the mental health services, the child care resource and referral services like Child Care Aware of Missouri, child care trainers in the community, and the schools, among others. We have a lot of lessons learned, but in particularly, we found that the assessment, response, and recovery must start immediately after disaster. And I think any community that has experienced disaster finds this out, that there's no waiting after a disaster. A child-focused response and recovery is essential and must be infused into the preparation, response, and recovery activities. And a children's task force dedicated to ensure stable environments and a return to normalcy and supportive to the social, emotional, and mental health needs of children and for their caregivers is critical for the recovery of communities. We still share information through our distribution list for the Joplin Task Force as things appear in the newspapers or as news comes out about Joplin's progress in recovery. The partnerships and collaborations formed are still working together. And with that, I will turn this over to Nicole, who will talk a little bit more about that.
Hi, thank you, Betty. Hi, I'm Nicole Piper, and I am with Child Care Aware of Southern Missouri, and we are the resource and referral that covers the area in Joplin. One advantage I think that we had as an agency was that we were 1 hour away from Joplin. I'm located in Springfield, and I think because our resource and referral was not directly impacted, our office did not have any damage from the storms, we were able to jump in and help right from the very beginning. One of the things that we found out is that, of course, as been mentioned multiple times, is that collaboration was the key after the tornado. We had to have the collaboration and the help from federal all the way down to the local area to make this happen. I'm having a technology issue here. Sorry, guys. Can someone move my screens forward for me? It appears that we're not sharing. Adam, are you there?
Yes, I'm here.
We don't have the PowerPoint up anymore. There we go. Thank you.
It is still
Nicole?
trying on my end.
Okay.
So can you
All right.
can you just
Yeah,
move us forward?
I'm there.
Okay, because I'm totally gone now. Okay, so sorry guys. The days immediately after, what were the things that were important to us? The main question on everyone's mind, pretty much all over the country and internationally, were how do we help? How do we help everybody, and how do we do that in a organized manner? We realized that there was plenty for everyone to do, and we kind of decided through especially the Child Care Task Force, that we would work smarter, not harder, and that was our overall philosophy. And then we just talked about what agencies were needed at the table to address child care issues. And then we knew at the local level that it was important to have people from the national, state, and local expertise that would be available. Next screen. Okay, collaboration was the key to our success. One of the things that we did nonstop was just go to meetings, just so that, for one thing, we were involved in the Joplin Child Care Task Force that Betty talked about. We had our conference calls twice a week to discuss specific facts about what was happening with the child care programs in the local community. We, as the R&R, were the boots-on-the-ground resource. Even within minutes, we were in the town of Joplin, making sure that child care providers, finding out which ones had been destroyed, seeing if we could help in any way. Then also we were very involved in the long-term recovery committee and the mental health subcommittee, and just because we wanted to make sure that in the community meetings that were going on, that child care was in the forefront and that we weren't forgetting the needs of children and families. Okay, so the next thing is that there were some new relationships that were formed and new funding that was formed that came about as a result of our relationships through the Child Care Task Force. One of the partners that I think Betty mentioned was the Ozark Center, which is the mental health provider in the area. They were doing the visits to all the different child care programs, and they were coming at the problem from a medical perspective, and they had some access to some local money, and then they turned to us knowing that we had the social emotional expertise and we had existing relationships with child care programs. The next slide. So we talked about the Healing Joplin and the Ozark Center. What they did was literally go out to every single child care program in the area, focusing on the mental health issues of specifically the staff and making sure that they were had their needs met, and if they had any needs, then they were making sure to address those needs with them. And then what we did is that we had a social emotional project that was going on in Jasper County with funding that the Ozark Center was able to provide us through the Missouri Foundation for Health. And we made sure that we did some training and on-site technical assistance for the child care programs. And then the result is that there was 1 year's worth of service to the community. Through the transition time even, we made sure that we continued our efforts through the Ozark Center and through our services through 1 year, through the anniversary, and importantly, definitely through the start of the school year, that next year. See, the social emotional project, what did we do with that? So we did some group training and some on-site technical assistance for the child care providers, focusing on the social emotional development best practices and what we know is important. So we thought that way we could provide the group training, and then we could go on-site and help providers with their specific needs. We also helped with some development of individual plans for children. If there were some children who needed some special services, we were able to facilitate that for the child care program and the family. We did a lot of resource sharing. We shared information on how to help children after the tornado, but then also what was important during this transition time is when we made sure that we focused on important events. in everyone's lives, like the holiday season that happened that year, and then the one-year anniversary, because those things definitely triggered things mentally for the children and for the families. We also did a lot of resource sharing for kindergarten teachers. We wanted to make sure that when preschoolers went to kindergarten that next fall, that kindergarten teachers were aware of the same tools that the child care programs were using, so that then they as kindergarten teachers could use those same tools with the kiddos. Then also we did some resource sharing with area businesses. We had some businesses who were asking us for help with their employees and with their customers, so we shared some of our social emotional supports with the businesses in the area as well. Next slide. We had some special events that took place during this time period. We had the Connect to Protect conference that we put on with several agencies in town. The conference was designed for professionals, educators, child care providers, parents, and caregivers, and we shared information on providing trauma-informed care to the families and children, and then we also had a component on taking care of yourself in the process. In order to serve others, you have to take care of yourself first. One of the other really big events that we did, next slide, was the Comfort Kits for Kids. We put together some kits within like 2.5 weeks after the tornado. We put together some kits that were specially designed to help children cope with stress and anxiety. And then there was also some information in the kits to share with the adults on how to use the items in the kit to help with stress reducers. Things in the kits were things like bubbles, stress balls, fruit snacks, journals, pens and crayons, Play-Doh, all the things that we know can help with stress relief for kids. We delivered over 10,000 of those kits to child care programs, the elementary schools, and the community agencies in the area. The first distribution was 2.5 weeks after the tornado, so immediately after the tornado, and then we did another distribution after school started in that September to make sure that the elementary schools had access to the Comfort Kits as well. And then finally, why was the Joplin Child Care Response a success? We all know that there was plenty of work to go around. We were able to drop our feelings of competition and just be able to work together. There was true collaboration with a meshing of funds. And we had national, state, and local partners working together. And there were relationships that were developed that have lasted forever. As Betty had mentioned, we still continue to have relationships and working relationships with everyone that was involved. And also, we needed to understand that the work will never be complete. I mean, we're how many years out from the Joplin tornado now, and we still are having to rebuild in a variety of ways. So here's my contact information. If you would like any information about some of the specific projects that we did, please feel free to email me or contact me. And I apologize, I still don't have the screen up, so I hope the screens were not too confusing for you guys. And with that, I'll turn it over to Gail. Thank you.
Thank you so much, Nicole. That was great. The examples of what your agency was able to do through partnership was really outstanding, and you were ready to respond and certainly picked up the ball and ran with it. So, Abby, another question for you. What did you hear about the Children and Youth Task Force, the organization at the state and local levels there in Joplin, that resonated with you, particularly for the participants in this webinar series?
Thanks, Gail. I think the very first thing was that Margaret shared with us the research about why we should all care about preventing or limiting the trauma. And Betty and Nicole really talked about the importance of being able to respond using their real-life example of the task forces and how important they are. While it wasn't included in the original OCC framework when it was developed, I think that the task forces represent a really significant opportunity to bring in additional collaborators to the table when you're doing comprehensive emergency planning, and to really strengthen the health and safety of children in care. The behavioral and mental health community has a lot to offer as people are planning around emergency, whether at the comprehensive level at the state or at the local level or even in the program provider level. And I think we need to look to that community to help us, as well as the R&Rs, such as Nicole's and others, who do work around developing systems of social and emotional support for young children. I think that her conversation, as well as Betty's, around developing relationships with all of these folks and collaborating will prove to be essential. And I think we need to think about these task forces as potentially a subset of the work that is done to develop comprehensive emergency plans, because we know that you can't wait to build the relationships and put a response together totally after a disaster happens. You really need to build those relationships before the disaster happens. So that's what comes to mind.
Well, thanks, Abby, and I certainly agree. And from everything I've heard, I wanted to make people aware of these two resources, one which came out in 2013 that basically grew from the experience in Joplin that Betty and Nicole have described, that really did talk about exactly how to put together a Children and Youth Task Force in Disasters group, whether it's a subset or whether there are specific focus of that group, that's each state's decision. Then in response to Superstorm Sandy, then New York has published some lessons learned, and those two offer great resources for states as they think about this part of planning ahead. We had some registration questions that you were asked to fill out when you first registered for this webinar, and so I wanted to give you a little feedback on at least one of the questions. So the question was, how are you intentionally working on building resiliency in young children and families? And these are some of the responses. Working with child care mental health consultants and the emergency planning team, looking at trauma-informed practices, which I think come out of the child welfare part of our work. Child care provider training there you have the Health Promotion Consultant Network. And focusing on the responsibility of the provider to the children and families. Agreements with mental health and the Department of Health and child care mental health consultants. Task force to develop the plan and training for providers. Some people are looking at resources, which is a great place to start. And so there's strengthening families. And that is certainly a way in which you support the resiliency in children. What I want to do now is introduce Jessica Burton. Jessica is the Associate Director for Psychosocial Programs in the U.S. with Save the Children. Jessie?
Hi, thank you. Good afternoon, everyone. So thanks so much for letting me be a part of this. I'm really excited to hear from such experts, both through experience as well as academic background. I think that the majority of my presentation really covers the idea behind resilience. And we know that resilience is really, both when we're talking about it emotionally or as a community element, is really the ability to bounce back. So when we're talking about child care and talking about resilience specifically for both children as well as their caregivers, and when we're looking through the lens of resilience, that can mean a lot of different things. So the ability for a child care facility to quickly reopen, the ability for a child to bounce back and get back into normal routines as quickly as possible and process events with his or her caregiver. These are all components of the phrase or the term resilience. So Save the Children does a number of things in the realm of both resilience as well as child care preparedness, response, and recovery, not the least of which is training for child care providers specifically on how to design their own preparedness plans. And a lot of that work has come out of all the way back almost 10 years now to Hurricane Katrina, where we learned, child care is one of the most essential services that need to be reopened in order for communities to get back to normal. And a part of that work really culminated in a partnership with the Department of Social Services in the state of Connecticut, where we did a one-year child care emergency preparedness initiative where we sort of tackled all of the elements
of child care emergency preparedness. So through the emergency preparedness lens, through the child care resource and referral agency lens, through the emotional response lens, we're looking at children as well as their caregivers' reactions to trauma, and how do we best prepare for all of those things as it relates to communities getting back to better. So some of the programs that Save the Children utilizes in terms of psychosocial programming to help build or support resilience. One is psychological first aid for children, and this is a really simple training that can be delivered to child care providers, to shelter workers, to parents, anyone who might be interacting with children on a regular basis or in the immediate aftermath of a traumatic acute experience, as Margaret was mentioning earlier. The second program is child-friendly spaces. These are just spaces that are set up. They're not child care, but they're set up as a space for normalcy and play for children to be in if they're in a shelter situation with their parents over a temporary period of time. It gives that child the space and ability to sort of play and have a little bit of normalcy in a traumatic experience. And then for our longer-term recovery, we've got programs along the psychological program continuum, one of which is Journey of Hope, which is really a cooperative play, literacy, discussion, art, and physical activity, small group education program for children ages 5 to 18. And then recently we've really hyper-focused on developing curriculum for both children as well as caregivers, sort of parent-child groups, but also child care or early care specialist training on understanding the impact of trauma on very young children. So a lot of the sort of scientific jargon and research and great information that's coming out now about really the impact of trauma on very young children, what Save the Children is trying to do now is make that tangible. So make that information, all of the great stuff that Margaret presented on at the beginning of this presentation, making that something that's user-friendly and easy for a child care provider or a parent or early care specialist to pick up and understand easily so that they have the tools and resources and they're really empowered to support the resilience of the children they're working with. So really the need, Margaret covered a lot of this at the beginning of this presentation, so I won't bore you sort of repeating things, but no child lives without risk to traumatic experiences. And Margaret did a great job of sort of showing the three different sort of categories of trauma. There's that acute trauma, which many of you are sort of planning for, which is the large-scale one-time disaster, and then the months and months and years of recovery from that. There's the traumatic situation where a child may be in an environment that is very unhealthy or something that's negatively impacting them on a regular basis. And then there's the traumatic stress, which can be sort of this constant ongoing. It can be community violence. It could be something in the home. But basically, no child lives without risk to traumatic experiences. And when children are really exposed to or live with several risk factors, it really can be traumatic, further disrupting their healthy development. As you all know, and are really experts in child development, you understand that the consequence can really be difficulty with learning, behavior issues, impaired relationships, poor social and emotional competence. And we know that those skills that are learned in that early age between the ages of 0 and 5, the understanding of how the world works, the understanding of how adults work, expectations on peers and how learning comprehension develops are all really critical for long-term success for children. So understanding how to mitigate and enhance the resiliency skills of children and mitigate the trauma, is really critical. So here's an example of what sort of a risk factor is. So consider Larissa, age 8 from Tuscaloosa, Alabama, which is one of the tornado-struck communities that Save the Children worked in for a couple of years, helping the community recover. She's an 8-year-old. She grew up in a single-parent family, pretty transient, moved around town quite a few times, and she belongs to a school that was 83% free and reduced lunch rate. So thinking of Larissa pre-disaster, pre-tornado, already living and learning with quite a few risk factors, and then you drop on top of that an extra layer of the traumatic experience of a tornado. And depending on the child's personal resilience, their past history with adversity and life challenges, we really don't know how that child might respond. So being ready and being prepared to support children at any stage, whether that be infancy and supporting parents and understanding traumatic experience, all the way up to 18 years old and helping children really recover. So there's a really great document put out by the U.S. Department of Health and Human Services, Substance Abuse Mental Health Administration, that you might look further into, which is psychological issues for children and adolescents in disasters. And it really gives a great breakdown of some of the different indicators that children might be struggling with stressful traumatic experiences. And this might be a good tool to share through your R&Rs in your states or other resource opportunities to help child care providers as well as administration leads understand, what should we be looking for? What does a traumatic or traumatized child look like? So STAMS has come out with a really good resource, user-friendly. It's pretty thick, but it's user-friendly, on how to support children in that. I'm going to skip through this because I only have a few minutes. One of the things Save the Children likes to point out in any of the work that we do is that children have really unique physical, cognitive, and emotional needs. I think that the folks on this webinar have a really good understanding why child care is so critical in terms of responding and recovering from disasters. So people can't get back to work unless they have their children in a safe, caring environment like child care. But we also know the other reason child care is so critical in terms of response and recovery is the children in the care of child care providers, that adult is 80 to 90% of their interactions through the day. So their attachment, their development, their learning style is going to be truly catered to how well that child care provider, that child care center director, and the community is recovering. So resilience is more than just individual personal resilience for a child and their caregiver. It's also critical that we're supporting child care providers in their own personal recovery. So again, a child's behavior during a disaster will be really heavily reliant on many factors, including their age, their social support. So do they have consistent adults in their lives, and are they going to a consistent schooling or sort of in terms of their schedule? Is it something that's regular that they're familiar with? Their personal cognitive development. So thinking about children who may have cognitive special needs or access and functional needs. And then their development of attachment. So how far along are they and how much disruption has been caused by the traumatic experience if it's a disaster. So thinking about children, thinking back to Larissa, my example, children who are coming from sort of negative environments in the first place, so living with high risk factors, can really further complicate the response and recovery of a child in terms of their resiliency and their ability to adapt. So examples can include academic performance, social interactions, higher risk for developing PTSD. And again, I'll echo what Margaret said, which is that not every child needs an intensive therapeutic response to an emergency. But some children might need something as simple as psychological first aid, which is just a listening ear and linking to any kind of resources. So that can apply to children in infancy all the way through to their 18th year. These are some of those typical reactions of children that I mentioned earlier from the SAMHSA document, and I'm sure you can look that up as you receive these slides, but some of the different signs and symptoms that adult caregivers can be looking for children. And I think this is a great resource and tool to be able to share, again, to empower child care providers to feel like they know what to look for and they know how to respond if a child is having adverse reactions to a traumatic experience. So I'm going to leave it at that. That's the slide for the final thoughts and questions. But I just want to sort of reiterate the work that all of you do on a daily basis to ensure that your states are well-equipped and prepared for all types of hazards and events is so critical. And the fact that child care is really getting this highlighted lens. In the last 10 years, we've really come a really long way since Hurricane Katrina. And I just want to champion all the work that you all do every day and how important it is. So thank you.
Thank you, Jessie. That was great, especially that shout out to all the people in the audience. We appreciate that. And so I'm just going to ask each of the presenters sort of in order if they have any final thoughts that you'd like to give us. While I'm doing that, if you participants would like to type in a question into the question and answer pod, which is on the top of the screen, just to the right of the PowerPoint. So Margaret, was there anything you wanted to say, any final thoughts?
Yes, my final thought was, as I was listening to all my wonderful co-presenters, was to highlight again that when we talk about emergency responses, that emergencies the outcomes of emergencies can last for a long time, a year, sometimes longer, especially. I actually shouldn't just say especially for children. I think traumatic experiences, experiences that have been very stressful and that take a while to recover from emotionally have, it can last for a long time, and to really consider when you think about intervention or response strategies, to think about that that it's important to keep your ears on the ground about long aftermath effects of the emergency, and to stay with the people you serve and kind of keep your support coming.
That's great. Thank you, Margaret. Betty, any final thoughts?
Yes, I would like to encourage everyone listening. Although our task force was formed in response to an actual emergency, I would say everyone listening that you need to be thinking about getting together some kind of a task force or work group now before you have an emergency, to really think about how to prepare and to be ready. You may not be the same people who would be on the ground in a task force after an emergency, but you certainly can put all the pieces in place to make that development and to give resources and to support in a community or in your state to make sure that you're meeting all the needs with a focused work group or task force.
Okay. Thank you. Nicole?
Yes, I wanted to add, I forgot to mention during my presentation that a lot of the tip sheets and the comfort kit materials, all of those items are available on the Child Care Aware of America NACRA website. If you go to www.naccrra.org and you look under the Crisis and Disaster Services, there are a lot of resources there for resource and referrals for disaster planning. However, there is some of the specific information that we created in the Joplin area that you can utilize.
Okay, great. Well, thank you for that. And finally, Jessie, any parting thoughts?
I guess I was last to speak, so not too much, but I would just say a plug for some of our emergency preparedness community engagement tools for Save the Children. My colleagues work hard on Get Ready, Get Safe, which is a new national preparedness initiative for childcare through education, as well as parents and caregivers in general. So if you want to go to savethechildren.org/getready, a lot of really great resources and tools free to the public are on that website. Thanks.
Sure. Well, again, thank you for that comment. Abby, are there questions that you want to pose to our presenters?
Yeah, I was wondering when Margaret was talking about, she showed us that wonderful slide of all the neural connections that are happening where there's such a significant development in the first year. I was just wondering if there's any age that's more vulnerable than the other. I mean, it's pretty clear from your conversation that trauma affects everyone, but just wondering about differences in ages.
Yes, that's a very good question. And typically the rule of thumb that is now supported by the research is that the younger the child, the more at risk for longer-term negative results, because the coping strategies that children develop, including brain capacities, are much more vulnerable. So, for example, once a child has language safely in place so that they can talk about their fear, so that they can understand when someone says, you know, it's all over now, it's not going to happen, these are just sirens because people come to help. So the less children can rely on language, the more likely they might be impacted by traumatic stress, as a rule of thumb. So yes, it's younger children, and you know, and this is not age-related, of course. As we talked about, the more other vulnerabilities they bring to the table, the more they will be impacted. But just in terms of age, the younger the child, the more they are at risk because they have fewer coping strategies, and the more they will need to rely on others to help them manage their stress. We call that co-regulation.
Thanks so much. I think it definitely underscores to the audience of a need to pay greater attention to infants and toddlers who many people think are not impacted at all, mostly because they can't speak about what they're experiencing.
Yes, exactly. It's quite the other way around.
Right. Okay, Betty, I was wondering if you have, I know you feel like it is very important for the states to consider developing a Children and Youth Task Force, and I'm curious whether you have any advice for the states about getting that started.
I would say bring together your natural partners to begin with to talk about it, and then look outside of your natural partners as you begin to develop your plan and to develop the task force, and to, as much as you can, think outside the box of those organizations and communities and in your states that touch children. Invite them to be part of the conversation. They may not continue on a continued basis to be part of a task force, but to make the relationships and the contacts so that as you respond and as you prepare, and then if you have to respond in an emergency, you've got a relationship already started in case that is a person that you need to bring in or an entity you need to bring into the conversation more fully.
Thanks so much, Betty. I want to bring our listeners who might have participated in our first webinar back to a conversation that Janice Molnar had for State Administrator in New York with regard to Superstorm Sandy, and she too underscored the importance of those relationships. You can't start building that relationship when you've got the emergency on your hands. So having those relationships built in advance makes all the difference. Nicole, when you were talking, it sounded like you had developed those special events, and I was just curious about the timing of those special events. It sounded like you had some things happening right away, and you also had things going on for some time, recognizing the length of some of this trauma that people experience, and when those kinds of feelings might emerge might be not right immediately after.
Right, and I think that one of the things that we really did focus on was immediate response, but then followed by that was all of the life activities that we know were going to happen that would trigger things for people. Like I mentioned, I think I mentioned the holidays. We tried to think about the time and how to respond around the holidays. We talked about the school, when the school year started, on that next fall, that next August, September timeframe, that we were available for them for resources, for the kindergarten teachers, for everybody. There was just, some definite planning. The conference took a little bit longer for us to pull together, but I think that was okay because not everybody was ready and able to participate in something that big until we kind of wrapped our arms around the immediate needs. But yeah, we kind of planned things out based on things that we knew that were happening, like the holidays and school starting, so that we were able to help when there was transition times for kiddos, which are the hardest times for kiddos.
Thanks so much, Nicole. And I think one of the take-home messages around that is having kind of a continuum of responses, which you clearly provided to the children and families. And Jessie, given Save the Children's big involvement in these areas and really key programs that can be great supports to child care, I was wondering, how does someone engage Save the Children to learn more about the programs?
Well, that's great. A great first stop is you can feel free to email me, and I can connect people with the right spot. But to learn more about what we do in the U.S., again, SaveTheChildren.org gives a lot of information about our international work as well as our domestic work. But looking at SaveTheChildren.org/Get Ready as a part of our Get Ready, Get Safe initiative is a good way to
get a good handle on some of the work we do, not only in general child care emergency preparedness, but also sort of state report cards we put out on an annual basis, 6 or 7 years going now, on how your state might line up against Save the Children's very basic minimum standards for child care emergency preparedness. Those are probably good starting points, SaveTheChildren.org and then .org/get ready.
Okay, thanks very much. And I'm not seeing any other questions and answers from the audience. Feel free if you'd like to send those in, but otherwise I'll turn this back over to Gail.
Thank you, Abby. We wanted to ask the participants if they could help us in this next piece. It's called the word cloud, and the idea is that there's a box that will appear in just a moment in the lower portion of the screen where you currently see the clock as the host is configuring the word cloud. The idea is that we'd like you to type in words that you will take away from the discussion of mitigating disaster-related trauma. We're hoping, there we go. Down here, there's a send button at the bottom of my screen, and then across from that is enter your message here. So I'm typing in, and so what words will come there? And as more words come up or people use them more often, then yes, I see people adding words in now. Younger, consistency, recovery, the task force, infants, collaboration. Certainly these things, they all make a big difference. And I saw the word vulnerable, preparation. Partnership. It's great to see those words and to think about the presentations today. You guys were really, really listening. I'm going to close that out now. And that's one of the great things. You'll be getting a copy of the word cloud as part of the follow-up to this webinar. So beginning probably tomorrow, maybe by the end of the day tomorrow, you'll certainly see that. We would like you then to do a poll now. The question, I guess I need to click over. Thank you, Adam. The question is, how will you use the information that's been provided today to move planning in your state, territory, or community forward? I think you can see there at the top of the left-hand column, type your answer here. What kinds of things have you already been thinking about after listening to today's conversation? I see someone has typed in comfort kits. Isn't that the truth? That sounds like such a wonderful thing for a child and family to receive, especially following flooding or tornado. Glad to see that the CCR&Rs are in your thoughts. They certainly are boots on the ground, as Nicole said. And I think it's never too early to think about looking at your website. Does it include things that really do support building that resiliency and supporting young children? Glad to see that you're considering being part of this, raising awareness, improving the preparation. These are all things that really do support moving forward. I'd like to remind folks that in our very first webinar about bringing those partners to the table, there was a tool. So if you missed that particular webinar, I believe it was a 4-page list of people, really positions and titles, that you might consider to include as you're planning your emergency preparedness and response plan for child care. I suggest you go back and listen to that webinar and look at that tool as you're developing your task force. Thank you for your input in both the word cloud and the poll. It's good to see that you already have plans for moving this work ahead. Susan, can you tell everyone about the resources that we're making available?
Yes, Gail, thank you. I must say, as we keep moving forward this afternoon, I think we've all identified more resources to share. So, but this one is very recently updated, helping children recover from exposure to trauma, and it specifically is provided by SAMHSA, and it is a link under federal agencies. It's recently released and relates to infectious disease outbreaks. You know, while today we've talked about the Joplin emergency and disaster that occurred, there are many, many types of emergency items that we are concerned with on a daily basis and need to remember about. And this particular resource actually includes a tip sheet for talking to children. And recently a colleague in Texas reported that her 7-year-old was at home due to the possible Ebola exposure of the school's nurse. So again, we never quite know what may be an emergency or an area that we need to provide some support regarding trauma for children and what that means to families and the young children that they have. So again, be watching for all the resources that are coming forth, but this is a very recent one that really addresses what our topic has been today on Webinar 6. Other resources that we've mentioned in the past and are available include the resource guide. The resource guide is quite broad. It includes the information memorandum, the letter that can be provided to governors, FEMA guidance, checklists, past response efforts, etc., as noted there. Quite a lot to consider. On our Child Care TA Network page, we have additional information, including the resource guide, emergency preparedness planning for licensing agencies, considering lockdown situations, and lists of state-level trainings, and much, much more. Please return to these pages often, as information will continue to be updated in response to the upcoming Child Care Development Fund reauthorization and rulemaking that is underway. So something that you want to pay attention to as you think about the needs in your state and territories. And as we move forward in closing out this afternoon, this is the final session in the Child Care Emergency Preparedness and Response Plan webinar series, but it's not the end of our interest or willingness to help states and territories think about, collaborate in developing, implementing, and revising plans for supporting the CCDF program, working with child care providers, supporting children and families in your state. We know that the CCDF reauthorization and our rulemaking may impact requirements, so something for us to be considering as we move forward, that emergency preparedness plans are part of this key work, and we know that emergencies do happen at a much more frequent basis than we may like, but it's important for us to be prepared and be ready to respond and help with recovery as well. Resources will continue to be available, and we have additional resources planned. As today you heard from our partners and our speakers, we have many other resource links that we can provide for you, and technical assistance may be available to CCDF lead agencies in the states and territories, and those of us working as part of the Child Care State System Specialist Network work very closely with our other Child Care TA partners and, of course, our regional offices, which Betty represented for us today. So in closing, I'd like to turn it to Abby for final remarks. Abby?
Thanks, Susan. Oops, I'm a little bit ahead here. So I wanted to conclude our conversation. Many of you have participated in all 6 of our webinars. Some of you have only selected certain ones that were relevant, but I did want to say that we recognize full well how difficult and challenging it can be to develop a really comprehensive and meaningful child care emergency plan at the state level, but I really want to encourage you that notwithstanding the challenges, it is quite doable to take chunks of that work and get it done. and we realize just how important it is to get that work done. As we have done this whole series of webinars, there have been multiple emergencies throughout the country, and no one can fail to notice, every night on the news there's another place that's undergoing a disaster, and so we owe it to the families and children and child care providers to pay attention to this issue, to do what we can do, and to think about it almost like continuous quality improvement, that we get down on paper in a plan whatever we have now with a parking lot that identifies those areas that we need to work further on and continue to work on those areas, and as they're completed, incorporate them into the plan. I think today we have heard about just how important it is to provide immediate and ongoing assistance to the families and providers to help them navigate the recovery process. We have heard quite a lot about the trauma involved, and I think I also want to emphasize, we didn't do so as much in this particular webinar, but how important it is to make sure that the supports that we provide people include information in a variety of media and a variety of languages to make sure that all people can benefit from resources that support them if they have undergone any kind of trauma. We really hope that the examples and ideas from today's discussion, as well as the entire series, will help inform you as you work in whatever capacity you are in to help make things better for children, families, and child care providers. So whether you're a state administrator at the state level, whether you're a local emergency management person or a resource and referral agency providing support to both parents and providers, whatever your role might be, we hope that the information that we've provided throughout this series will be helpful in your work. And again, I want to reiterate that all of the material is going to be archived and will be made available to you for your participation. So I want to close by just saying how we sincerely thank our speakers today for their willingness to share this process, and for all our speakers throughout the entire series, and for all of our audience participants for their interest and concern in this issue. We want to thank you for your participation, and we hope you leave here energized to develop the necessary plans and tools that you'll need to respond in an emergency. So thanks again. Goodbye.